With us, Democratic Senator Chris Coons of Delaware, who was on the Appropriations Committee. Senator Coons, great to have you on.
Trace, thanks. Great to be on with you again.
Same lead question, because you had both John Thune coming out saying, listen, there is nothing to negotiate. Open the government and then we'll negotiate. And on the flip side, you had Chuck Schumer saying, we just want to negotiate.
Well, Trace, it's pretty striking that the House of Representatives hasn't come to work for weeks. And what you did just play, Chuck Schumer saying, was we need to sit down and negotiate a way to avoid huge increases in health care for millions of Americans, which kicks in on November 1. I support that. President Trump ran on lowering our costs and making Americans healthier again. And what's going to happen to millions of Americans on the Affordable Care Act exchanges November 1 is that their health insurance rates will go up dramatically. In Delaware, our insurance commissioner has already published rates that say health insurance will cost more than at any point since the last Trump administration. There is a way forward. We could negotiate around this. There's a letter circulating now by 13 House Republicans urging Speaker Johnson to bring them back into session and negotiate to fix this urgent, imminent rise in health care costs that'll impact all Americans.
John Thune was asked about that. He said, look, the House has done its work. You mentioned the House being out. He said the House has already done its work. It is now up to the Senate to do their work. And I guess the question to you would be, why not just vote yes on the continuing resolution, open it up, and then do the negotiating?
Because I have no confidence that if we reopen, there will be negotiations. There is a path forward here where we get a commitment to a path forward to votes on our appropriations bills and to this Affordable Care Act fix, but that's so far not been put on the table. I do think President Trump has a critical role to play here. Before he leaves our country for a week traveling in the Indo-Pacific, I hope that he will sit down with Minority Leader Schumer and with Minority Leader Jeffries. He can break this impasse. He has said in the past that he doesn't want Americans to see huge increases in their health insurance costs. No. If he says, let's do this and work out a deal, I'm confident it can happen. If he doesn't, then we're going to have more and more Delawareans calling me saying they're concerned their health care costs are skyrocketing.
Yeah, it's interesting you mentioned President Trump there, because the numbers guy over at CNN said this shutdown is not hurting President Trump's numbers at all. In fact, it's improving the numbers. Watch this.
This shutdown hasn't eaten into Donald Trump's support at all. His net approval rating is actually up a point in terms of his popular support. So the bottom line is this. The first shutdown during Trump's first term, 2018-2019, was hurting Donald Trump. This one is not hurting him at all. There's no real reason Donald Trump might say, at least when it comes to popular support, I want to get out of this shutdown.
Kind of a weird dichotomy, right? Because you have Trump's numbers going up because of the shutdown, and yet you have a Reuters poll coming out and saying that 50% blame Republicans. What's your takeaway?
Right. So, Trace, my takeaway is that all of us should be working together to try and avoid needless pain to millions of Americans. Longer emergency room waits, an inability to get preventive care from physicians. I've heard from doctors, from hospital leaders in Delaware who are saying that they are bracing for impact. The president should be worried less about who's getting the blame and who's getting the credit, and more about working with us to find a path forward to avoid skyrocketing health insurance costs. In most states like mine, those letters go out November 1. That's when my citizens, the folks from Delaware, will find out how much their health costs go up. And I think there's going to be a big push on us to fix it then. My concern is it'll be too late.
Right.
Instead of spending time bailing out the Argentine government to the tune of $40 billion, instead of spending time on building a new gold-plated ballroom at the White House, I wish our president were spending time negotiating over how to avoid these big increases in costs.
You say, Senator, that you've heard from your doctors and they're telling you the rising costs. We just heard from a doctor who also happens to be in the Senate, Bill Cassidy, who says your plan is going to drive costs up because you want to give health benefits to illegal immigrants, which, by the way, is true in a lot of cases.
That is not at all true. And as I know Dr. Cassidy, Senator Cassidy, and I know he knows this, it is not legal to be enrolled in the Affordable Care Act, Medicare, or Medicaid unless you're in the United States legally. There is no path here for giving health care to illegal aliens. That is not a core part of the agenda of the Democratic Party.
Where we are right now in California, Senator.
Tell me what that path is.
The path is that in California, they have been giving health care to illegal immigrants, and they've been asking the federal government to fund a portion of that money.
Using state money.
And the federal government is wanting to pull. No, they're not using state money. They're using federal and state money. And they're asking for the federal government to give more money.
It is against the law. It's in the statute. It is against the law to enroll in the Affordable Care Act, Medicare or Medicaid.
They're not enrolled
if you are here illegally.
They're giving benefits, medical benefits, to illegal immigrants, and they are asking the federal government to fund a portion of those benefits.
Okay. Trace, in my state of Delaware, that is not happening, and nationally, it is not legal to enroll people in Medicare, Medicaid, or the Affordable Care Act who are not here legally.
Senator, thank you for your time. We appreciate it. Best of luck.
Thank you, Trace.
We hope this thing gets worked out.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.